You will have seen from last night, I do have a series of important messages to share with you today. Our Director of Public Health is here with us in person, and the Minister for Health and Social Justice concern. The Council of Ministers met on a number of occasions throughout Monday to review the evidence as it developed and to ensure we had plans that may have linked them. This would have given us a better understanding. We received confirmation of this late last night, and they cannot understand. We can now see that we want nothing to jeopardise our vaccination programme that is about to enter a new phase with significant supplies due to arrive onto the island throughout this month. It concerns us because we have seen what has happened elsewhere when community transmission is left unchecked. I would also stress that we are very mindful of the significant cost to any form of circuit break lockdown. I do not just mean the obvious financial and economic costs, but the human, health. At this point, I'd like to hand over to Dr. Hewitt to give you an update.
Back till Friday, although we were seeing a steady increase in cases, all of those were related to high-risk contacts of cases already known to be linked to the current cluster. The two cases that emerged on Friday evening couldn't be so linked, but in both those cases, apart from household contacts, other wider contacts had been really quite limited, apart from a few low-risk locations of interest. So again, although we couldn't tie those cases to point, there was evidence to indicate that in fact might give us a link back to a venue associated with the cluster. So it was really not until last night and the emergent considerable spread in terms of geography and also in terms of the different demographics to definitively understand the missing links, that is the people through whom transmission must have happened to take it to where it's got now. We may never know. So clearly we will still be following all the usual best practice for contact tracing, but there is a much wider community spread issue out there now which we need to respond to. Thank you.
Thank you, Dr. Hewitt. On current projections, we hope that we will have given a first dose to all our priority groups, so all over 50s, and all during April. If we were facing the same situation in a month's time, then perhaps the outcome might be different. We hope that progress on our vaccination programme will continue to build our defences and mean that we do not need circuit breakers in the future. We know that there is a moment where we will be able and will need to move from a policy of local elimination to one where we live with the virus. The situation around us beyond our shores is changing fast, and we are not a million miles away from that point. But equally, no one around the world is saying they are quite ready at that point yet. We will be publishing our medium-term approach for returning to a more normal situation with our borders, and that longer-term outcome has to be the ultimate goal that we focus on. We had hoped to publish it earlier, but obviously events have unfolded at pace. So in the future, our approach may be different, but we are not there yet, and we need to act now in a way that we know works. If we allow our health and care services and vaccination programme to be destabilised, then that plan might get derailed or delayed. That is why we tried so hard to wait to have more information and ensure our response was proportionate. Late last night, we decided that we do now need to act. After lengthy discussions that weighed heavily on our minds, we have decided that we cannot allow anything to put this longer-term exit at. If we do so now, and if everyone does their bit, we will stamp out the current outbreak that seems to be moving under the surface of our community. Once we get into the future and our most vulnerable are protected, we may be able to take things differently. But right now, we need to eliminate this outbreak. We do not want to be in and out of lockdowns and circuit breaks. We have gone in hard and fast, and this has worked. We decided that we want to do the same again. We have therefore decided that we will be heading into a further circuit break from 1 minute past midnight tonight. So for clarity, the first minute of Wednesday, we will be putting in place and legalising for a set of clear measures. We will be doing this as we did the last time, for a period of 21 days. We will review this constantly, and as before, we will only keep measures in place for as long as we judge them necessary. If we can adjust them earlier, we will. If we have to extend, we will. This time, as well as the number of active cases, progress in the vaccination programme will be also an important factor for us. The measures will be similar to what we had in the last circuit break. It worked last time, and we have every reason to believe it will work once again. These measures will come into force from the first minute of Wednesday, but I would encourage everyone to start immediately if possible. Let me take you through what we have decided. It is broadly where we were in January. We need you to stay at home. There are only a few exceptions to this, for essential things like getting food, daily exercise or work if you really cannot work from home. You can also leave home, of course, if you are going for a medical appointment or to be vaccinated or tested. We will be implementing social distancing measures, so 2 metres, in all settings where it is possible to do so. If you do go outside, we strongly advise you to wear face coverings as much as you possibly can. We will again insist on this on public transport. If you go outside to exercise, please do so in a way that is safe. Keep others and avoid crowds. We need you all to stop all household mixing. This is absolutely key to stopping the We will again allow building suppliers to open for trades, but not to the general public. All lifestyle businesses, hairdressers for example, must close. From tomorrow morning, schools will close to the majority of pupils, and the online learning, which worked well in January, will recommence. The schools and their existing settings will only be open to children of essential workers and to vulnerable children who need it. If parents are able to work from home and keep their children at home, it is essential that they do so, as numbers are limited. We are keeping the schools in their existing places this time, rather than consolidating in hubs, based on feedback the department received. This is to give a better who do. Parents are asked where possible to keep their children at home as space is limited. In line with the third week of our last circuit break, we will not be stopping the construction or other related trades where they are outside or on vacant properties. We will, however, require them to fully practice social distancing and other mitigations, and they will not be able to enter any households unless for emergency repairs. Allowing these trades to continue is based on feedback from last time, and taking on feedback is something we have committed to do every time we have to step into difficult positions such as this. Everyone who can work from home must do so. We need businesses to support on this as they did before, and ensure that they have only staff who are absolutely essential to be on site. Let me again thank everyone, including all of those local businesses who took responsible action over the weekend. We appreciate what you did, and as we have said before, where we make decisions that impact you, we will be there to support you. From Wednesday, we will be reactivating the financial support measures, including MIRA, salary support and the business support scheme. The Treasury Minister will provide a statement in the House of Keys later today. I know this will be far from easy this time for so many. I know there is a great cost in locking down our island and our lives, but we believe the alternative is now even more costly. I know we have asked you so much in the past, and I know we are asking you so much again, and I am truly sorry that this is happening. but our collective judgment throughout yesterday and last night, as more information became clearer, was that this is what we need to do. I've always said that we will do what is right for the island, and this is what we are doing, the right thing. Talking about doing the right thing, I've been asked why we did not say something at 7 o'clock this morning. There was a risk identified late last night that had to be dealt with first, which was specific advice to Year 8 at Bemmerhague School. If we had told people at 7 a.m. this morning not to go to work or school without any time for companies or individuals to prepare for what could have been a 3-week period, then businesses and parents could justifiably criticise government for not allowing sufficient time in which to prepare and for businesses to continue to operate within the new rules. In truth, what we would have seen is thousands of people having to come into work anyway in order to prepare for what we are asking them to do. It is recognised of the issue that we are having this conversation now rather than our usual time. People will have the remainder of the day to prepare and position themselves properly for the next 3 weeks. And just before we go to questions, I'd also like to point out that the Minister for Education, Sport and Culture, Dr. Allenson, is also on Zoom to ask any questions you may have. And first and foremost, we have Simon Richardson from Business 365. Good morning, Simon. Moramai.
Good morning, Chief Minister. I suppose the overriding feeling is here we go again. But I also think on many people's lips is why wasn't stronger action taken on Saturday? Now, you asked people to stay at home. You didn't order them to. A lot of people didn't heed the advice, and they went to pubs, attended parties, etc. In effect, we allowed, I suppose, a virtual mini Cheltenham races scenario to develop. Now, I acknowledge hindsight is a wonderful thing, but we now face a potentially serious outbreak that might have been curbed at the weekend.
Well, at the time we couldn't legislate at the drop of a hat. We asked people to be responsible and not to go out. And I'm glad to say the vast majority of people did stay at home. Large events such as charity balls, Douglas Corporation, I think, had an event, and all these were cancelled. So an awful lot of events were cancelled. The vast majority, yes, there was a small minority of people who chose to not respect the advice that we were giving, but at least we did manage to avert an awful lot of gatherings. Obviously, we were waiting for more information. We had tested the high-risk contacts, and we were waiting for that to come back to see if they had the virus. Over the weekend it became apparent that they didn't have the virus, and therefore, as a result, we thought we had it under control. But Dr. Ewart, you might want to expand on that.
Thank you, Chief Minister. I think that's right. It's always a very, very difficult call to make. And as I explained when I was going through the timeline of the gradual addition of these unexplained cases, the two that we knew about Friday evening into Saturday had not been out and about very widely at all, which actually enabled us to take a call that from those cases there was little evidence of high likelihood. They hadn't been out in pubs and clubs, they hadn't been to parties or events. So we were able to take that middling view. As the Chief Minister has said, you can't just switch restrictions on and off. There is a process to go through in order to make them legal. So on the basis of the information that we had at the time, going for that call of putting out an advisory and an information approach appeared to be appropriate. Thank you.
Thank you. Your next question, Simon.
Well, obviously now in a situation of different mutations in the community, now, which brings us back to a topic that has been regularly aired at the briefings, and that's the matter of testing and the breakdown in the relationship between the department and Dr. Glover and her company, Genomics. Now, it means, in effect, we don't have real-time genomics to respond to cluster cases and identify in rapid time these specific mutations we're dealing with. Now, Dr. Glover says that the whole argument comes down to a biomedical scientist copying her company's software. Now, she's said that she's prepared to put the dispute to one side and work collaboratively with government. So in view of what we're facing now, why isn't this happening? Her argument obviously is that we need to break transmission chains and not hope they just burn out.
Right, well, I'll ask Dr. Hewitt to come in on that, and then the Health Minister may want to add something.
Firstly, genomic sequencing doesn't help us break transmission. We do that by using all the usual methods of epidemiology and contact tracing to identify persons, times and places, test for whether they're positive, self-isolate. In fact, knowing the genomic sequence makes no difference to that immediate response. Certainly from an epidemiological point of view, it is extremely interesting to be able from, and you'll remember the cluster we had immediately after the new year. Initially, we thought there were 2 cases there, I think possibly at 1.3, that couldn't be linked back to that cluster on the basis of the information people had provided to us. The genomic sequencing indicated that they did all relate to one travel-related event, so they were the same cluster, and that led to further contact tracing, which, if you like, and enabled us to fill in the missing pieces. With much wider community transmission and the issue of, as I've expressed it, the missing links, that's the areas of moorland where there was no fire, but where fire might well have been passing. Because of the time course, we're never going to be able to get positive samples on people, even if we could identify who they possibly might have been, and therefore there won't be any genomic sequencing. We know that all the cases we've seen on Ireland since mid-January, that includes cases within the current cluster and other unrelated travellers coming across and being tested in the usual way. We know that they're all Kent variant. We also know we have other travellers who have opted for 21 days self-isolation and no testing, so we will never know whether they were positive, and if so, what variant they might have been. So the real-time benefit of variant testing, to my mind, does not impact on our acute response.
And David, would you like to comment on anything?
Yes, thank you, Chief Minister. Can I first of all say, Simon, obviously, as Minister, I can't comment quite rightly on anything that either is subject to or may be subject to any form of legal action. In relation to genomic sequencing, the Director of Public Health has covered it off very well there. Very good at looking backwards, genomic sequencing, and it does have a role to play, but it is not the time-sensitive role. Dr. Glover quite rightly says what we need to do is cut chains of transmission, and what does that is contact tracing. Our contact tracing team looking at those cases that have tested positive and then isolating those high-risk contacts around people. That is what makes the difference, and that's what stops a widespread outbreak. Genomic sequencing plays its part, but it is not as time-sensitive as the contact tracing. And can I just say the relationship between DHSC and Dr. Glover has nothing to do with the genomic sequencing. We have always used the Liverpool facility for genomic sequencing. We've never used Dr. Glover, even when she was contracted to the department. And the situation has not changed. We have access to a world-class facility in Liverpool that gives us access to wider data and builds us into the wider understanding of COVID-19. It's used by multiple countries around the world. It's overseen by 3 world-class professors, and we should be very, very thankful, actually, as an Ireland, that we have access to that kind of facility at no cost to the Manx taxpayer.
Thank you very much for that, David, and thank you very much, Simon. Now we move on to Sam Turton from Jeff. Good morning, Sam. Moramai. I keep on wanting to say Fastamai, but it's Moramai.
Moramai, Chief Minister. It seems that since the weekend we all knew where this was going, and fair enough, you had issued the advice on Saturday, but then on Sunday we said there was no restrictions and the pubs reopened and everyone went back to school and everyone went back to work. Can I just ask, was it to not go into a medical one, or was there a division politically in terms of the Council of Ministers on whether or not we should enter a lockdown?
No, there was no divisions, Sam. What we were facing was the fact that we'd had 2 cases. We obviously didn't know where they'd come from, but we did the testing straight away on their close contacts, and on Sunday we got the evidence that they did not have the vaccine, and therefore they hadn't been spreading it around the community. So we've always said, just when you get 1 or 2 cases, we were never going to lock the island down, and we had clearly seen that on Sunday the were not high risk, they weren't shedding in the community, and therefore we had hoped that that element had been put to bed, and that's why we felt the need that we were able to open up again. I don't know, Dr. Hewitt, if you want to expand on that.
Yes, Chief Minister, thank you. I think that's absolutely fair comment. Lockdown has huge implications on a whole range of fronts. It's not something to be undertaken lightly, and one has to therefore on whether we still consider that the cases are containable through contact tracing, self-isolation, wider testing, or whether there is an indication to go for an island-wide change in level of response. And on what we had available to us over the weekend, we were not recommending that we should escalate a lockdown response.
Yeah, I'd just like to give a little bit of a time frame, Sam, just to help you. We at about 8:15 last night that we had 2 unexplained cases. Before then, we'd been looking at 4 cases, but we thought there might have been a link, and that was being tested as the time went by. However, at 8:15, it became aware that we had 2 further cases, which we didn't believe were linked to any other cases, or we didn't know at the time. I immediately called a Council of Ministers meeting at 9 o'clock, and at 10 o'clock we started contacting the school that was involved and started to put things in place. So we have moved really quickly on this once we realised it was a situation that we didn't feel that we could control. I don't know, David, if you want to add anything to that.
Yeah, I mean, we moved as fast as we could with it, Sam. As the Chief Minister's laid out the timeline there, Council of Ministers was meeting late into the night to discuss this. We had to draw up proposals that we wished to move forward with. They were agreed. They had to be agreed as well. But I think also the other important point to make is that there is always with COVID a time delay in the fact that people tend to present symptoms generally 4 to 5 days after they've actually developed COVID. And so it is highly likely that the chains of transmission and people's infection occurred prior to Saturday.
Okay, thanks, Sam.
Thank you. And just secondly, Public Health England have put out information relating to vaccines and the efficiency of both vaccines that we're using on the island, saying that a first dose can give up to 80% protection in the over 80s. People are asking us, given that you've already said we're expecting a big influx of vaccines onto the island this month, why are we not stepping up with the first doses now, relying on that we know there are more coming in quicker than there would have been?
Thanks, Sam. And David, I think you can give a far more detailed in these increased numbers. We've now got additional ones we've just found out. But David, if you'd like to give a full detailed answer.
Yeah, I certainly would, Chief Minister, and the answer is we are stepping up the first dose, as Sam. I explained this at a briefing previously. It doesn't actually make much change to our rollout in terms of the figures. I think I said it makes 2 weeks difference. And that is why I announced the other day that we expect now to have all the over 50s with their first dose of vaccine done in April rather than in May, which was the original schedule. And actually, we will have done the doses for the over 50s on exactly the same timescale that the UK is laying out. Because again, we have to remember about language. The UK is using the language of inviting people for a vaccine. That doesn't mean people have actually had the vaccine. The UK deadline for everyone over the age of 50 and in the vulnerable category to be done is around mid-April, and that is exactly the same as ours is.
But just in terms of that, it's impossible to go quicker now that we do know we have more coming in. Is it not possible to speed up even quicker the island's vaccination?
Once we receive the vaccine, we may well be able to do that, and I may well in a couple of weeks be announcing that the date has moved forward again. We don't yet know, as I explained at the previous briefing, what the numbers will actually be in terms of the additional vaccine supply we will get. So it is important we see what comes on Ireland, and once we know what that additional supply is, hopefully I will be able to announce positive news that the date might move forward again.
Thank you.
Thanks very much, Sam. Now we move on to Paul Mull. Good morning, Paul. Moromai.
Good morning, Chief Minister. I need to go back to the timeline last night and the very late press release. I think it's the number one question that's I've been asked so many times last night was, Could you not have just made some of these announcements there and then in the press release? For instance, the lockdown was going to happen. Children have gone to school today, yet now you're saying they're not going to go back tomorrow. And in fact, the education minister was on the radio saying it was voluntary today to go to school. This seems yet again, and I keep asking it, it seems communication hasn't been your finest point on this.
Well, I suppose we're damned if we do and we're damned if we don't, Paul. We finished our meeting at 10 o'clock last night. We obviously had to focus on speaking with the head teacher of the school involved to make sure that we could put procedures in place as quickly as possible so the school didn't wake up in the morning, even at 7 o'clock, to find out they had a problem. That was being worked on. And we put a press release out straight away to all Timble members and then obviously onto the media outlets saying that we were going to be making an announcement. Now, it's important that we give, and we've done this before, if you look at the lockdown in January, for example, I think at lunchtime on the 5th, Tuesday, I said we were going to be closing schools on the Thursday. So we didn't do it straight away. It's not the sort of thing you do because our young people need to go into school to get their IT equipment so that they can work from home. And also parents who may have businesses that need to put their business in order need the day to put the kids into school so they can go and get short of supplies, etc., turn their business from maybe inward facing to outward facing if they're going to be doing deliveries, etc. They need time. This is what we found out from the last time. It's no different than the last time. In fact, it's probably slightly quicker that we've announced it. I think given the magnitude of what we are announcing today, it's important that I do it face to face with people rather than putting it in a detailed press release. And, if I give you an example, in the United Kingdom, you get a little leak that the Prime Minister is going to give a press statement at 6, 7 o'clock in the evening, and that can be 24 hours in advance. We put out a notice late last night, the minute we'd finished the Council of Ministers. I think it went out about 11 o'clock to you all, or circa that time, and that I would be doing something first thing in the morning. And here we are. And that's what we're doing. There are so many variants, Paul, and I appreciate some people will say, oh, you should have done it earlier. Some people will be happy with what we've done. We're damned if we do, damned if we don't. We've been pretty quick off the mark when you consider it was only late evening last night that we found out about these two cases, and we moved, except, we had been planning a way forward if we did have more cases, and that's why we've been able to move so quickly, probably half a day quicker than the previous outbreak. But I understand your concern. It's not an exact science.
But because this is presumably the Kent variant, it's so more transmissible, you've probably put people in dangerous situations this morning that could have actually made their own choices not to have been in that situation, surely.
Well, we put a press release out advising that I would be making a statement and that we would be bringing in restrictions from 1 minute past midnight Wednesday morning. So I don't know, Dr. Allenson, if you'd like to come in on the school side of things.
Thank you, Chief Minister. What I'd like to say is in terms of schools, we need time to prepare. That's what today is about. It's giving parents the confidence that their child will be looked after, that they will be given choices, and that their child's education will continue through either remote learning or, if their child is classed as a vulnerable child or a child of a key worker who has to go to school, then obviously a key worker has to go to work, then obviously they'll be looked after. We're also going to be working with the preschool sector in terms of nurseries and childminders to provide this. But it's very important to get this into perspective. Yes, we do have a small number of cases in the community, but we can react to this in an organised way to make sure that we don't panic, to make sure that we take people along with the decision-making process, and also that we look after those children and make sure that their education isn't interrupted. What I tried to do this morning on Manx Radio is make it quite clear to those parents who might be anxious about sending their child to school that this wasn't mandatory, that they did have that choice, but some parents would not have that choice because they need that time to prepare, and that's what we will be providing today through the Education Service.
It's also worth pointing out that obviously when we had a case with St Mary's School, we we asked the year that of the child that had sadly caught COVID-19 to stay at home. That's exactly the same procedure that we've done with Bemmerhague. We didn't shut down St Mary's, it carried on, but we asked that year group where the high risk setting was to stay at home whilst we did tests. We've done exactly the same with Bemmerhague. The rest of the school will be low risk. But again, Paul, I get your concerns. There's no perfect answer to this. We've just done our best based on the past experiences where we know parents have to go to work today to prepare, and that children need to get their IT, because at the end of the day their education is incredibly important, and making sure that they can work from home and have the right tools is really important. Your next question, Paul.
Yeah, but just had that. Someone's been on to be asking, can you clarify about nurseries? Are they affected on the lockdown? Do you know?
It's the same as last time. Alex, do you want to come in and give the detail on the nurseries?
Certainly, Chief Minister, what we've done in the past is work with nurseries and childminders to make sure that spaces are available for vulnerable children and those children of key workers who desperately need to go to frontline services and provide things like the healthcare that we all rely upon. We'll be working with those providers during the course of today. We'll also be addressing a whole range of other issues that we've the provision of free school meals to ensure that people are looked after during the circuit break lockdown. Thank you, Chief Minister.
Thank you. And my next question is for Dr. Allison. Again, back to the schools. We had a lot of comments that why have you picked only that 1 year when clearly there's transmission of people moving around schools, they go to the wash basins and so on. Plus there was school activities with other schools taking place. We've got other parents very worried. Anything you want to add to that about this interaction with other people from other classes and other schools?
Certainly. With the track and trace system to identify the risk. You're quite right that infections can spread amongst schools, but we also know that even with the Kent variant, the transmission rate between child to child is relatively low and certainly not as high as it would be from child to adult. I understand that some of the activities that went on last week in terms of the interaction with other schools were outdoor activities and so seen as quite low risk. So what the track and trace system have been doing is trying to quantify that risk so we can react in a proportionate way. We can spend today preparing for the closure of schools, and we can look after those children, take them through what is, again, quite a difficult process for them and their families in an organised way. But we will keep the safety of those children as our key priority throughout this and act accordingly. So in answer to your question, yes, there is a risk between transmission. That risk has been assessed by the track and trace system and is being dealt with on a case-by-case basis to isolate that year group, to make sure the infection hasn't spread, and then to take action accordingly.
And just to finish with, should people pick up their pupils whenever today and take them home if they can, in a position to start shielding today?
Well, it's not a matter of shielding. What we're trying to do is ask people to stay at home wherever possible from tonight. I think today, as I said before, is really a time to prepare for the weeks ahead. I wouldn't necessarily want parents to be coming in and disrupting classes. Teachers are going to be doing a lot of work today to reassure pupils, to actually guide them through this process, to make sure that they're looked after either when they're in the school environment, if they need to come in, or when they're at home through remote learning. So I think picking your child up at the end of the school day as planned, or allowing your child to come home as planned, is absolutely appropriate. However, what we is an anxious time for parents and children. We know that children aren't significantly affected by the virus, although they can control. If parents want not to send their child to school today, or they want to pick them up early, that's absolutely fine. What we'd ask to do is work with your head teachers so that this can be done in an organised way.
Thank you very much. I think we lost a little elements of Dr. Allinson there, but I think the main thrust of the answer was clear. And as I would say, last time when we had this situation with St Mary's School, the parents and the pupils and the staff at St Mary's School handled it absolutely excellently with the contact tracing team, and it did go exceptionally well. So I have no doubt that the same situation parents and pupils of Bemmerhague Year 8, and I wish them all well. Next we have Kenna from Isle of Man newspapers. Good morning, Helen Moromai.
Moromai, Chief Minister. My first question is probably for yourself or the Health Minister. Why does it take so long to legally bring in legislation to impose a circuit breaker? Well,
you've got to get all your ducks in a row. That's something that we have in place now. We've worked on it over the weekend and we were ready to move as quickly as we can do. However, we have to give people time to adjust. So that's what we've done. We've given people today to get their businesses in order, their children's education, equipment in order, so that we can have a successful 21 days without people needing to go in and maybe cause more problems as a result. So there's an awful lot of incredibly, to make sure it's legal and can survive legal challenge. We've got a team who have been working flat out over the weekend and today, and it will all be ready and be brought in place for 1 minute past midnight. Having said that, the legislation could maybe have been brought in slightly early, but it is important that we give people the notice today to get on and sort their lives out and ready for this. It's what we've done in the past. This is nothing different, nothing new. So I don't want to think that we haven't gone into lockdown till tomorrow because of the legislation. It's ready. It's purely we're giving the people of the island the chance to prepare, but also obviously we're asking them to start social distancing straight away and wearing face masks. I know, David, if you want to add anything to that.
Very briefly, if I may, Chief Minister, it's just to say that legislation is a complex process. It does have to stand up to legal challenge. We have to make sure it's right and at first time, and that means we have to go through it in detail. Legislation can be turned around same day. What was different on Saturday, which is perhaps what you're alluding to, Helen, is of course it was quite late in the day. We knew there were events due to start about 5:30 that evening. There was absolutely no way on earth with the timing of things that we could have had legislation drafted, approved and in place for 5:30 that evening. It would have, at the earliest, have been later that evening. So that's why we took the decision. But the Chief Minister is quite correct. At every single time when we've had an outbreak or a cluster, whenever we've had to bring in measures, we have all to prepare. And I think that's very, very important. We've got the messages out there as to what we would like people to do and what we want people to do, but immediately. But then we have said to people, you've got that grace period, because there are certain people who may decide, for instance, today, that because they're going to be locked down for 3 weeks in a circuit breaker, that they might want to move in with other members of their family for that period to form a household due to mental health issues and so on. We need to give people time to do that. We have done throughout, and I think it's the right thing to do.
Thank you very much. Your next question, Helen.
My second question is probably aimed at the Chief Minister. How will government ensure that people whose jobs will be put on hold, obviously during lockdown, are sufficiently supported through their circuit breaker? And Dr. Hewitt mentioned before that eventually, obviously, we want to eliminate we'll have to obviously live with the virus. And is there an alternative, basically, is what I'm asking, to a circuit breaker? Is there any sort of thought into how it can be? I mentioned, I think last week at the last briefing, a watered down version of lockdown. Obviously, a lot of people's lives are being put on hold. So basically, will there be an alternative to lockdown in the future?
Yeah, well, there's 2 points. First and foremost, the same financial support, Helen, will be there. It'll be started on Wednesday. The mirror, the financial support, etc. What was there in the last lockdown will be reintroduced tomorrow, and the Treasury Minister will be giving a statement in the House, as usual, from support to people. Now, obviously, been in this position, say, in a month's time, when we had given the first vaccine to all our vulnerable groups, then obviously there might have been a more watered down situation, because we've said we're never going to have we're not going forward to be totally eliminating COVID on the Isle of Man, which is where we are at this moment in time. We will be moving to living with it, but we're not in that position yet because we're still in the winter period for the hospital, for beds, and we haven't vaccinated enough people in the categories where we had. Obviously, maybe in a month's time that would be different, but we have made change to this lockdown, to this circuit break than we did to the circuit break in January, and that is we are allowing outside trades, the building sector, the window cleaners, gardeners can carry on working as long as they comply, mitigating circumstances, social distancing, not going into people's houses, etc., unless it's an emergency. So this circuit break is slightly different, where a significant number of people can continue to work from. So we have made subtle, well, quite a significant change there because it's outside, and as we now have more people vaccinated. So we will be moving from total elimination to living with it. Sadly, it's probably come a month to 2 months too soon, and we felt that we needed to go back into the circuit break to eliminate it, and that's the position we're in. But a good question, Helen. Thank you very much.
you.
Next, we have Josh Stokes from ITV Granada. Good morning, Josh. Moramai.
Morning, Chief Minister. First question to Dr. Hewitt, please. In terms of the lockdown being in place for 21 days, it does feel like a short time to regain control of what's happening. Given where we're up to with the unexplained cases, what's your initial thoughts on how long we could continue to see spread in the community now that a lockdown has been implemented?
That's really impossible to call. We will continue to see spread, obviously, within household and close contacts. We expect that, and that's what we saw with the cluster. The wider spread is really down to behaviours. This is a virus that spreads overwhelmingly from person to person via droplets, that it may also be spread by aerosol, that's smaller particles that get up into the air and can be recirculated, and therefore cause infection at a time when direct contact isn't happening. And there is also theoretical evidence that it might be spread by surface contamination. However, in terms of the overall burden of transmission, it is overwhelmingly the direct contact transmission that drives the numbers. And that is down to people's behaviour. If you don't mix, you won't transmit it, you won't be infected. So that's really the message for everybody, that you have to take this seriously. Over and over again, we find, and I know it's a common feature that's found just as much in the UK and also in Ireland, is people justify things to themselves. They think, oh, it'll be all right if I just, go into this household, do this, hug that person, whatever. Actually, you might not, and if you don't, it's not only you that takes the consequences of that, it's everybody else that you might then go on to interact with and infect. So you stop mixing, you stop transmission. So we have to take that message very, very seriously. Thank you.
Just as a supplementary to that, I guess the crucial part was, do you think 21 days is long enough to control this in a lockdown?
It's a good starting period because it is one incubation cycle, which is 14 days, plus a half cycle. Obviously, if we're still seeing cases springing up sporadically, randomly in time and place across the island during those 21 days, we will have to keep re-evaluating as we go through that time period. So we can't guarantee that we will achieve a return to low or zero transmission in that time. The key to achieving that is for everybody to actually follow the guidance. And I know, people get weary of this. I think we all do need to take it seriously and not to justify ourselves in breaking the restrictions, and keep hold of the fact that within a month or two, we will be much clearer on the benefit of vaccination, and the vaccination programme will have been rolled out that much further. And so, we have to hold to the thought that with luck, this may be the last time we need to go through this process. Although, of course, we can't guarantee that. Thank you.
Thank you.
Thank you. My second question to you, Chief Minister. What communication has the government had with the police when it comes to enforcing these new rules? And is it exactly the same in January? What part will the police play in this new lockdown?
Exactly the same. They did a sterling job the last time in the meetings that we have. Obviously, the Minister for Home Affairs and Justice is part of that, and he liaises with the Chief Constable and obviously the Chief Secretary and the team when they meet to have discussions. That the Chief Constable is from time to time is part of those actual meetings, so they will be fully adverse as to the decision, and they will carry on with their well-run procedures that they did in January.
Thank you.
Thank you very much. Next we have Leanne Cook from 3FM. Good morning, Leanne. Moramai.
Good morning. My first question is for the Health Minister. We've had a question from someone who is classed as clinically vulnerable. Previously, when the islands entered lockdown or a circuit break, they've had to shield entirely. They've now had one dose of a coronavirus vaccine. They're just wondering, going forward, will they have to take the same course of action, or will it change now they've had a dose?
Well, thank you very much, Dan. That's a very timely question, actually, because if it hadn't come up in the briefing, we would have been putting a press release out anyway. In terms of shielding, we are advising that those that have previously shielded, shield again. That is regardless of whether they've had the vaccine. Now, the reason for that is the efficacy of the vaccine builds up over time. It's not instant the moment you've had a vaccine. So because this has come so early in the day, it's important that those that even have had one or even two doses of vaccine still continue to shield if they're in the shielding category, to allow the vaccine to work on their system and to give them the protection that they need. So I know that will be frustrating for many people, that yet again they're being asked to shield for the 21 days. We will review that as the process goes along, as the period goes along. But for the moment, regardless of whether people have had the vaccine, we are asking them, if they have shielded before, to do so again, please.
And my second question is also for yourself, and just a question we've had from a member of the public. They're just looking for clarification in regard to what the current procedures are there.
Yeah, so visitation has reverted back to exactly what it was during the previous circuit breaker. So it is essential visitation only. So essential visitation would be for those who were in a very serious condition, end of life. And we are also doing exactly the same. That is what we've recommended for care homes and nursing home settings as well, because again, although those in a care home setting have overwhelmingly been vaccinated, like we say, the vaccine takes time and the efficacy builds up over time. Unfortunately, this has happened, like I say, a bit too early, and we therefore do require those people still to shield, and we do need the restrictions on visiting to be in place.
Okay, thank you.
Thanks very much, Leanne. Next we have Tim Glover from Manx Radio. Good morning, Tim. Moramai.
Moramai, Chief Minister. Just some of the comments we're getting in here. Little Britain, it's appeared like over the last few days. Yes, but no, but yes, but. Control freakery of Coleman with information. People are saying they wanted to make up their own minds, and they're also concerned about mixed messages, because while we've been at this conference, government has put a tweet out. We need you to stop all household mixing. This is absolutely key to stopping the spread. And yet we've got the schools and people around the island going about their business to get ready for a lockdown.
Well, that's standard procedure. Of course, from now, where possible, you need to not mix with others, and social distancing comes in tomorrow, but we're asking where possible if you can start it now. But as we've said time and time, to enable people to get their businesses set up for the circuit break, we need school children to be able to get their IT equipment, etc., ready for this circuit break, so that life can go on as smoothly as possible whilst we're having to go through the circuit break. I mean, obviously on Saturday we put a message out asking people to not go out, because we had a case that came out of out of the blue that we needed to react quickly to. So I think we've been as consistent as possible. It's not an exact science dealing with COVID, and you're waiting for data to come along, and that's what we were doing yesterday, for example, until these two cases came along at 8:15, I found out. So it's a moving feast all the time, I'm afraid. Or maybe Dr. Hewitt might like to expand on the time.
Thank you, Chief Minister. I think the key issue there, and you mentioned, I haven't seen the tweet from government, but you mentioned that the tweet said that we want households to stop mixing. Households are the highest risk environment for transmission of COVID-19. Clearly, that's one's own household. If you live in a household with somebody who's the chances that you will become infected are very high, higher in the winter than in the summer because of the issue about people spending time in heated rooms with poor ventilation. If you invite other people into your household, you're effectively putting them into that same high-risk environment. The risk of transmission in school, the risk of transmission in workplaces is far lower. So the tweet was absolutely correct in stressing the importance of stopping the household mixing.
I think it's important. So I'd challenge you, Tim, to name it constantly without giving any notice to people. Obviously, we're asking people to be responsible in the lead-in time to tonight or first thing in the morning. They've got lives to give. They've got their businesses to sort out. Their children have got to be sorted out from an education point of view. But in the interim, whilst they're going about doing all that, if they can try and do the social distancing, we highly recommend the wearing of masks, and if they can stay at home, if there's no need for them to go out, then we're asking people to do that now rather than wait until the lead-in time. But we realise that the vast majority of people need lead-in time to prepare themselves for a 21-day lockdown or circuit breaker, which is what this is. And as I say, this is standard procedure across the world. We're not doing anything that's radically different, and as I say, to try and shut down instantly just would be a disaster. It would cause more problems and probably add to more spread than a controlled, well-measured way forward is what we're looking for. That's what we're trying to achieve.
Second question, this latest lockdown excuse me, came as a result of a steam packet worker. A lot of fire's been directed at the steam packet, but don't you need to look a bit closer to home to Cabinet Office, who will have issued a company direction notice, and then 11 months later, it's not being complied with, it's found out. There was an attempt, I think, to sweep it under the carpet somewhat on Sunday, but wasn't someone at Cabinet Office asleep at the wheel here? And does this not need a full and independent inquiry?
Yeah, well, I have actually asked the Chief Secretary, Tim, to do a review of the situation so we can learn from it to ensure that it doesn't happen again. Obviously, it has happened. It was a genuine misunderstanding with the steam packet making their English UK team follow the rules, but not the Manx team. The key defence is not necessarily that element. It was the wearing of PPE on board the ship to stop the transmission between the two crews, because obviously the Manx crew never went off. But yes, I have asked the Chief Secretary to have a review so that we can learn from this. We should always learn when problems happen, and this isn't any different. But I think it has been a genuine misunderstanding, and yes, we must learn from this, but I don't want it to be a witch hunt. Thank you very much, Tim. And now, last but David, are you wanting to come in?
Yeah, it's just one thing there, Chief Minister. I just wanted to challenge Tim. You say the current lockdown circuit breaker is due to the steam packet. We don't actually have the evidence of that. The cases that have driven the decision are of unknown origin, so we don't know where they've come from. We cannot say definitively that those lines of transmission have come from the steam packet cluster. So I just need to make that absolutely clear. It's important that we don't run away with this and say it's down to the steam packet cluster, because we do not have the evidence to be able to say that.
Yeah, very good point, David. It's also the case that if we knew where these two cases had come from, then we might not be standing in front of you today saying that we're having to go into a circuit break. It's all about proportionality of risk. So this is not traced back to Isle of Man steam packet. It could well be someone has come in who's travelled in and hasn't followed the rules. We just do not know at this moment in time. Right, but finally, but not least, we have Alex Bell from BBC Isle of Man. Good morning, Alex. Moromai.
Good morning. You've said today that the focus remains on elimination. We've known about this cluster for a fortnight now. We've watched as cases grew day by day. Had you intervened earlier on, could this latest lockdown have been avoided?
Well, we have a clear policy where obviously we're not going to lock down the island or have a circuit break just for one or two cases. If we know where they've been, where the people have been, if we've been able to establish a link, which we have done on the previous two cases, and if we've then tested all the high-risk contacts of those people and have all come back as negative, then we know that as far as that risk and what we're aware of hasn't spread around the island. It's only very recently that we've then had the additional cases which have tipped the scales. I think Dr. Ewart might want to expand on that.
Yes, thank you. Until Friday and the first of the two unexplained cases, all the other cases were linked very clearly to the transmission chain relating back to the steam, and the vast majority of them were already in self-isolation. So there was no onward transmission risk from those, given, of course, that they were abiding by self-isolation rules, which, as far as we were aware, they were. There were a couple of cases subsequently located related to a location of interest. Again, those were self-isolated and the transmission chains appeared to be under control because wider testing of people in that venue did not indicate any further spread. None of this can ever be perfect because always there may be people who were in that venue who chose not to come forward for testing for whatever reason and might therefore have potentially been out there spreading. So it's an imperfect science, but nonetheless we do follow standard principles and protocols for consistency because we know from, well, not just the history of COVID, but all the history of epidemiology and contact tracing, that that approach actually does work. So it was only on Friday that we began to see issues that caused us to have wider concern that there may be other branch lines of transmission, if you like, which we hadn't got controlled within the approach. And then, of course, the subsequent emergence of cases over the weekend and yesterday confirmed that, and decisions have been made, as you have now heard. Thank you.
Yeah, I suppose it's quite ironic, Alex, that in January and December we had two separate cases. The first case that we had towards the end of December we had under control. There didn't seem to be any more cases, and then we had another outbreak in New Year's Eve into January that clearly was from a totally separate case, but had travelled all over the island and had caused us to go into lockdown. So at this moment in time, we may well have two separate cases like we did in January. But obviously, we'll be doing more tests to see whether that's the case or not. But incredible impacts on people's mental health, not just the economy and welfare, etc. So we've got to ensure that we don't just do a knee-jerk reaction when we get a case, that we've done our best research to see if we can trace it, if there's a link. It's when we don't feel confident that we know where a case has come from. That's when we really have to move, and that's what happened to us last night.
There are now more than 50 cases of COVID. Do you not see why, to some people, this seems like the situation has been left to get out of control before you've done anything about it?
Yeah, well, of those 50 cases, Alex, some of them are travel related. They're not all down to this cluster. Some of them, in fact, a significant proportion of the cases are people who were already in isolation and therefore had not been infecting people around the island. They were high risks to the initial cluster and were in isolation, so they were not in the community. It's unexplained community cases which is the main cause for concern, and that's when you make your decisions. We have 6, just to put it into context. So that's not a lot, but it's enough to make us change our minds and go into lockdown. We only had 2 of those late last night that we knew about. So it's not big numbers of the unexplained type. Again, Dr. Ewart, could you expand on that? And then maybe David might want to come in as well.
Yes, that's right. And I've already said this today, but I'll just say it again. The initial 2 cases had not been out and about very much. So the risk that there was wider dissemination from them was judged to be not high. And then, of course, they and their household contacts were placed in social self-isolation. The subsequent case that emerged on Sunday and the related case amongst the non-household contacts that emerged the following day appeared to have a plausible link, and obviously we took forward, as usual, the work around locations of interest. And then it was only yesterday evening when we had 2 further cases which indicated further geographic spread and wider demographics in the nature of the individuals involved in those 2 cases that made it become more clear that this is about a moorland fire, a peat fire, slow burn under the surface, which obviously needs stronger response than just managing the individual cases and contacts.
Thank you. And it was really just 3 weeks ago that you appeared, Chief Minister, in the world's press with some considerable pride about how the Isle of Man had managed so far. If we emerge from this unscathed or not very scathed in another 3 weeks, will you be doing the same?
Well, I'm always proud of the reaction, throughout this whole pandemic, the way the Great Manx public have responded to this and followed the advice and enjoyed 8 months of unbroken normality on the island, unlike most of the rest of the world. I've always been proud. I would point out that at no time did we go out to the media saying, look at what we've done. It was the media that came to us asking to see how we'd done it. It was certainly not us being complacent. And I said, in all the interviews I've done with the media, look, we're not complacent. It can come back. We've got to follow the rules. So, I can't foresay what will happen in 21 days' time. Hopefully we will be out of this and the UK media will say, well, the Isle of Man's done it again. But only time will tell, Alex. Thank you very much. Well, thank you all very much for those questions. Today is all about preparing, giving businesses notice, allowing schools to plan, and allowing everyone to be prepared. As I've said many times before, there is no need to panic. There is no need to buy any more provisions than you need. It is important to think of others, and I know our incredible community will rally around those who need the help most. So today is about getting ready. This is tough. I know it will be hard on families and on our businesses. It will be hard on our health and well-being, and it will be hard on our children. I do believe, though, that if we get this right one more time, if we stamp out once and for all the transmission that has been sitting under the surface for some time from then, where possible, for some time now, we will be fine. So, where possible, please stay at home. Thank you for tuning in today. I'm sorry that we've had to announce this, but I hope you can appreciate that we've really had no option. So stay safe, everyone, and we will, of course, give regular updates, and I hope to be able to give a briefing tomorrow. Thank you all very much.